Hello, everyone, and welcome to the 2021 edition of the Ontario Medical First Responders Competition. On behalf of the Chancellor, Elaine Lawrencell, the Priory of Canada, and on behalf of St. John Ambulance Council for Ontario, it's my pleasure to welcome you as you demonstrate your skills of applied first aid in a uniquely competitive environment. My sincere appreciation is extended to Paul Sims, the chair of the competition committee, and his entire team who've worked so diligently within a constrictive environment to provide you a safe and hopefully enjoyable venue to demonstrate your skills. I am sure that many of you have participated in our COVID response in Ontario, whether at food banks, delivering protective equipment, staffing COVID or vaccination centers. Your efforts are making a difference. You are amongst St. Johners around the world who are carrying on nearly a century of humanitarian service under the 8-pointed White Cross. For all your efforts, we extend our most sincere gratitude. Today, you'll have an opportunity to participate in an ingeniously modified program that will not only allow you to demonstrate your individual skills, you will still feel the rush of the competition as you pit your knowledge against that of your peers. Friendly competition is an excellent way to challenge us all to achieve greater competency in responding to real emergencies. You know, over 30 years ago, I chaired this very competition committee, and I know it's likely before some of you were even born. The competition's come a long way in that time, and you are the next generation of St. John leaders that will keep us relevant for the next 30 years. Once again, my most sincere congratulations to all of you for your dedication to St. John and Ontario, and staying home with a prize or not, you are all winners this day for St. John. Have a great competition.
Hello, and welcome to the competition. Over the past 30 years, I've been a competitor, coach, judge, and organizer, and I'd like to recognize the work of the organizing team. On behalf of the competitors, thank you for your creativity and continued efforts to challenge us and help us learn. Competition is a fantastic way to practice our skills and challenge ourselves to improve. This has been a year where many St. John members have explored new ways to engage with each other and their communities. This has included supporting COVID screening and isolation sites, creating new virtual training opportunities, doing virtual visits, filming YouTube videos, and the list goes on. This competition is yet another example of that ingenuity. If you have new ideas and ways to support each other and your communities, please connect with your branch. Continue to follow the direction of the Public Health Advisory Task Force, who will continue to guide our training and service activities. Enjoy the competition, good luck, and have fun.
Good morning, everyone, and welcome to the adult SFA level of the OMFRC. My name is Sandra Ladd, and I am the Chief Judge, and I'm sure many of you who have done the OMFRC before and have attended our May event may recognize me. Also on Zoom with her video on is Marcia. Hi, Marcia. Welcome. And Dawn. So we are going to be running all of your competition today. In order to do that, I'm going to share my screen. And then we're going to walk through how to use Kahoot. Okay, so I want to make sure everybody's comfortable with Kahoot. The best way to do it if you have the access is with your computer or whatever device you're using open in front of you. If you have a secondary device like your phone, you can open up a browser and type in kahoot.it. If you're using the same computer as you're watching this on, that's okay as well. Just open another tab or a different browser if you have multiple browsers. And again, you're going to go to kahoot.it. So we're going to practice first, and this little mini quiz is 4 questions long so that you guys can see how it's going to work. And what I need you to do is, sorry about that, we're going to go to kahoot.it, and you're going to type in the PIN 3232575. It's going to ask you to put in your name, and we ask you that you put in your full name so that we know who you are. So everybody can go to kahoot.it and type in your name. There we go. So right now, Creative Llama's in. When we do the actual competition, I need you to make sure that you put in your actual name. So we've made this one with a whole bunch of fun names just so that nobody can see anybody else's score. But on the actual competition, we're going to be putting in our full names. And we'll just wait. Right now, we've got 14 people going to play the practice. Here we go. So 15 people. We'll just give it one more second. 16. And on your phone or other device that you're using, you will see how you did. Okay. So we have 16 people and we're going to start the practice. Here we go. So the first type of question is called a quiz question. What year was the first aid course in Canada held in Quebec City? So you're going to use your device to answer the question. You'll notice as well that there's a countdown clock over here where I'm showing you on the main screen, purple circle, and that tells you what's left. So when everybody has answered, it goes right to the answer, and the answer to this question is 1882. So great job. What you'll see next is Bronze Newt, whomever that is, answered it the correct way as well as the quickest. So they got 973 points. Okay, we're going to try the next type of question, which is a true and false. The eye hospital is in Jerusalem. Holy cow, the answers are flying in right now. That's great. And the countdown clock hits 0 and the answer comes up as true. The eye hospital for St. John Ambulance is in Jerusalem. The next type of question, it's going to take a little bit more work on your part. It's type the answer. Cardiopulmonary resuscitation is abbreviated as, so use your keypad to type in your answer.
Sandra, can I have that pin again? We have some people trying to get in.
This is just a practice. I can't get the pin for you right now, but in just a minute, I will have the actual competition go.
Okay.
Okay. So the answer is CPR. Cardiopulmonary resuscitation is abbreviated as CPR. And you'll see in the scoreboard, Bronze Newt is still answering quickest and the most correct, but one answer wrong or right can get you up to the top. The last type of question we're going to give you is a puzzle. Put these Knights Hospitalers' history in order from oldest to newest facts. So this one takes a little bit more time to do usually, so I've given for all of these types of questions 1 minute for you to answer. For anyone who's done knowledge of the order, they may remember the order of these. If you haven't, that's okay. Remember, this is just a practice. These types of questions will not be on the competition. These are just fun play. Let's practice how to do it. Okay. Newest or oldest to newest facts. You'll notice until all 19 people have answered, it makes us count down. Okay. And the answer is they were founded, then Blessed Gerard was appointed as first master. They fled to Rhodes for the first time and then established a new headquarters in Malta. So let's see how everyone did. Again, these are fun names. Soaring Owl, whomever you are, you got 3rd place. Second place went to Bright Rabbit, and the first place went to Bronze Newt. Fantastic. So that is how we play Kahoot. Before I start the next game, the actual competition, if anybody has any questions or comments, wondering how to play, feel free to unmute yourself and just ask your questions so we don't have anybody not being able to participate. Does anybody have any questions? Marcia is also going to be watching the chat during the game because as I'm sharing, I can't watch the chat. So if you do have questions along the way, Marcia will write in the chat. And I'm sure Marcia can write in the chat the PIN number to get in for the competition. Okay, we're just about to start. There's no questions. We're going to start the competition. Here we go, everybody. There's 45 questions. Our PIN number is 5889814. Remember, please use your full name. 5889814.
It only asked me for my email, so I can't really type in my full name.
Okay, if you want to just put your first name at least so we know who you are and you're playing. Okay?
But it only asked me for my email, not my name.
Are you using the Kahoot.it website or are you trying to use the Kahoot app?
I'm using the Kahoot.
Oh, okay. Can you close out the Kahoot app? You don't need to use the app and just go to the internet. And on there, type Kahoot.it.
Okay, just hold on.
Sandra, some are saying ask for the email first and then adding their name.
Okay, so you may have to put in your email and then add your name.
Could be a setting difference with this one. I don't know.
Okay.
Just have to watch the time.
Yep. So we've got 18 people in. We'll just give everybody another minute to get in.
I think 18 is the number we're looking for at this point.
18 is?
There's
Okay.
there's 23 in the session, and I believe there are 5 support people in.
Okay. Oh, there we go. I was going to say, I don't see Benny in yet.
Ah,
So
there we go. Good.
Sorry, I'm having a bit of connection issues. Can you wait a minute?
is everybody in that wants to play? If you're not in, please unmute yourself and let us know.
Could you wait a bit, please?
Looks like Audrey is looking to get in.
Okay. We did have 19 there for a second. I see we also have Marika's cat. Okay, Audrey's in. Okay, if we're all ready to go, here we go with the competition. So our OMFRC Adult Standard First Aid. Our first question is a quiz. You find a 22-year-old woman suspected drug overdose who's unconscious. What type of consent do you have? Holy cow, look at those answers flying in. And it is implied consent. Great work, everybody. Next. So I'm not sure how to pronounce that, but 6'9", which is not a name, is in the lead. True and false. A concussion is a temporary disturbance of brain function, usually from a blow to the head or neck. True, everybody, great. Excellent work. That was so fast. You guys are so quick with this. Great job. You'll also notice along the side, as you increase your points into the top 5, there's an arrow that comes up beside your name. Quiz, which of the following would not make a good dressing? What would not make a good dressing? One more person. We've got this. What would not make a good dressing? And the answer is toilet paper, because toilet paper breaks apart. Everything else would absorb really well. Up we go. We still have climbers. This is great. And Evelyn, you've moved up. You're the highest climber. Great work. True or false? The casualty is complaining the bandage is too tight, but the bleeding hasn't stopped yet. It's okay to leave it too tight. The bleeding is still coming through, as you can see. What do we do? Do we leave it on nice and tight? And the answer is false. If the patient is complaining or the casualty is complaining it's too tight, we need to loosen it. Wow. Look at the points already. Only a couple questions in and we're already near 4,000 points. A quiz question. When the body cannot get rid of excess heat, blank may occur. When the body can't get rid of excess heat, blank may occur. Hyperthermia. Yes, high temperature when we break down the word hyperthermia. Great job. We've got some big climbers there. Leonie Tam is the highest climber now. Another quiz question for you. Abnormal or a normal respiratory rate for an adult is how many breaths per minute? The normal respiratory rate for an adult is how many breaths per minute? The normal respiratory rate for an adult is 12 to 20 breaths per minute. Great work, everybody. We're getting close. We're going to catch 6-9 quiz. The primary assessment is the most important part of ESM because it identifies what? What does the primary assessment identify that makes it the most important? In the primary survey, we identify life-threatening problems, airway, breathing, circulatory problems. Look at that. The top 5 have not moved. Great work. Let's see if we can get up there on the top 5. Everybody with a puzzle. Put the following AED sequence in the proper order. Put the following AED sequence in the proper order. What do we do first when using an AED? We want to potentially help the person in cardiac arrest. So we're going to pull out the AED, but when we go to get it, we should also be doing what in the proper order? And the proper order is call 911 when you go grab the AED. Determine the patient is not breathing and no pulse before you put it on. Turn on the AED and listen to the voice prompts. So again, call 911 right away. We want to get the ambulance coming. Keyford, you've moved up to the top. And Ethan Chan is our highest climber that time. Great job. Here we go again. Another question, a quiz question. For you to properly perform CPR, the patient must be in which position? In order to perform CPR properly, the patient must be in what position? They need to be supine. So that means their spine is to the ground, so they're laying on their back. It's the only way to do CPR. Really hard to do it every other way. Let's see here. We've got some risers, Sarah and Michael. Great work. Sarah, welcome to the top 5. Here we go. Quiz question. What is the CPR compression to breath ratio for an 18-year-old? What is the CPR compression to breath ratio for an 18-year-old? So an 18-year-old is an adult. What is the compression? It is 30-2. Great job. Kiefer, you've got your little flame beside you. You've got 10 in a row. Excellent work. Next one, it's anatomy. The bones that make up the shoulder girdle are, which bones make up the shoulder girdle? This is in your textbook, your first aid textbook. Who has read the textbook in the back section where there's anatomy? The bones that make up the shoulder girdle are the clavicle and scapula. So the clavicle is right beside your neck where your collarbone is, and the scapula is the shoulder blade. Oh, we've got some movement again. 6-9 is in the top, but Cecilia, you're back in the game. You got 3 in a row. Great job. True and false. The most common symptom of a heart attack is respiratory distress. The most common symptom of a heart attack is respiratory distress. And the answer is false. We've got some movement. Again, Kiefer, you're on fire again. And Megan, welcome to the top 5. Quiz question. Anatomy. The blank is made up of the top, back, and sides of the skull. The blank is made up of the top, back, and sides of the skull. And it's called the cranium. The cranium is the skull. There we go. 13 answers in a row. Great job. True and false. The normal pulse range for an adult is 80 beats to 150 beats. The normal pulse range for an adult is 80 to 150. And that is false. The answer is the normal pulse range for the adult is 60 to 100 beats a minute. 150 is really fast. That is for an infant. Great job, everybody. Quiz, anatomy. The passage of air in and out of the lungs is called in and out of the lungs. So the passage of air in and out of the lungs is called respiration. So in and out counts as one breath or one respiration. Our top 5 hasn't moved. Come on, let's beat them. Let's get up on the top 5, everybody, with a true and false. The tongue is the most common cause of an airway obstruction in an unconscious adult. The tongue is the most common cause of an airway obstruction in the unconscious adult. This guy in the picture's got a huge tongue, and it is true. The tongue, a muscle, can fall back and partially obstruct the airway. That's why we do a head tilt chin lift or a modified jaw thrust if you've learned it. We've got some movement. Audrey, you're up on the top 5. Great job. Coronary artery disease does what? Coronary artery disease narrows the coronary arteries. That's right. We have some movement. Audrey, come up. Kylie is doing great. 3 in a row. Great job. A quiz question. AEDs will shock what? What will the AED shock? AEDs will shock only certain heart rhythms. So the 2 heart rhythms that an AED wants to shock is called ventricular fibrillation and ventricular tachycardia. 6-9 is on fire. Great job. 10 in a row. Quiz. Generally, if your casualty is verbally responsive adult, use the blank pulse to assess their vital signs. If the casualty is verbally responsive adult, use the blank pulse to assess their vital signs. Great job. And what do we got? Megan, you're welcome back to the top 5. Here we go. Quiz. If you find a severe bleed in your patient during the primary assessment, you should do what? So this fella has got a severe bleed in the primary assessment. You need to do what? You need to control the blood flow immediately. That's right. Everybody got that right? You need to stop that spurting right away. Here we go. We've got a puzzle, one of these tricky ones. What is the proper order you should perform a secondary head-to-toe assessment in? According to your textbook, what is the proper order you should perform a secondary head-to-toe assessment? We want to perform that secondary survey head to toe. That's a hint.
I can't put them in order.
We've got lots of time left. Anybody who needs to get in, the proper order should be performed in which way? And the order is the head and neck, then the chest and abdomen, the back and pelvis, and finally the extremities, head to toe. Great job. Okay, a quiz question again. What is true about a myocardial infarction? Which of these statements is true? What is true about a myocardial infarction? And the answer is it means death of the heart muscle. That's right, a myocardial infarction is also called a heart attack. So that can kill the heart muscle. We haven't moved our top 5, but Marika is in with a streak of 3. True or false? The human body needs both oxygen and sugar to produce the energy that sustains it. The human body needs both oxygen and sugar to produce energy that sustains it. True, everyone got it right. Excellent job, everyone. We've got 8 people with 4 in a row. Great work. Audrey's moving up. Type the answer. The process of making decisions at an emergency scene where multiple people are injured is called what? Think about how it's spelled before you answer. The process of making decisions at an emergency scene where multiple people are injured is called what? There are lots of people hurt here. We're going to enter the scene, and what are we going to do? We're going to start. We're going to start triage. Great job. 15 people got that right. So when multiple people are hurt, we're going to do triage, which means to sort out who is the sickest to the least sick. Next is a quiz. Pale, ashen skin, chest pain, radiation to the arm and jaw, sweating, cold, clammy, shortness of breath are signs of what? All of these signs, pale, ashen skin, chest pain, radiation to the arm and jaw, clammy skin, and shortness of breath are all signs of what? Angina or a heart attack. Great work. Great work, everyone. Look, we've got some climbers. Off we go again. A quiz question. Shivering is what? Shivering is what is shivering? We all do it, especially here in Canada. When we shiver, it is the body's attempt to generate heat. We're trying to warm ourselves up. Our top 5 haven't moved, but we've got 6 people who just got 7 answers in a row. Great job. A puzzle. In general, basic emergency care for a chest injury must include the following steps in correct order. Again, this is right from your textbook. Basic emergency care for a chest injury must include the following steps in correct order. What is the order in the textbook to take care of this poor guy who's been stabbed in the chest? It's a pretty big chest injury. We want to make sure that we're going to help him, so we want to do everything in the proper order. What is it? Got 4, 3, 2, and the answer is maintain an open airway, assure adequate ventilations, perform a rapid body assessment, and control any signs of bleeding. So that is right from your textbook. What do we have? Marika, you've got 3 in a row. Great work. Off we go with our next one. Type in the answer. A blank is something the casualty is feeling and must tell you. A blank is something the casualty is feeling and must tell you. You can't see these things. You can't hear them, smell them. So they have to tell you this. And it is called it is a symptom. So a sign is something you can hear, smell, taste, hopefully not taste on your casualty, but you can experience with your casualty. A symptom is something they feel, and they have to tell you these things. Jamie, great work, 9 in a row. On fire. We've got a poll question for you. I want to know if you're having fun. This will not change your points outcome. So tell me what you think of this way we're doing the competition in a virtual format. Do you like Kahoot? What do you think? Okay, so it's working out. Puzzle question. This one counts for points. Place the 4 steps of emergency scene management in order. This car's flipped over. There's someone inside. What do we do in order? Almost there. The 4 steps of emergency scene management in order are what do you think? The 4 steps of emergency scene management.
Yeah, I have trouble giving more than one answer.
When we first approach, we want to do this. Then we're going to look at the casualty for the first time. So the first thing we got to do is a scene survey, make sure it's safe and how many people are hurt, a primary survey, then a secondary survey, and ongoing casualty care. How did we do? Oh, our top 5 are still our top 5, but there's been some movement. Here we go again, a quiz question. The acronym AVPU is used to determine what? AVPU is used to determine what? So in first aid, we use this term AVPU. And it's the level of consciousness. Great work. 16 people got that right. Our top 5 are still just burning through the points. Great work, but we've got 11 people that have got 3 in a row. Keep it going with a puzzle. Place the 4 steps of turning a patient face up in order. So you've got a patient who is prone and we need to turn them supine, face up.
Evelyn, you're moving the blocks with your mouse or with your finger.
Place the 4 steps of turning a patient face up in order. And this is right again from your textbook. It's a great resource. When you've got some spare time, pull it out, read, take it in, get all the right answers. And then it becomes second nature. Place the 4 steps of turning a patient face up. So we've got our answers in. And the first thing we want to do, extend the arm closest to you over the head, tuck the far arm against the casualty side, cross the far foot over the near foot, and support the neck and head while you grip their clothing and roll them. Welcome, Ethan, to the top 5. Great job. True and false. If assisting with nitroglycerin for chest pain, it can be repeated every 5 to 10 minutes. If assisting with nitroglycerin, it can be repeated every 5 or 10 minutes, and that's true. As long as the patient still has chest pain, you can keep repeating up to a maximum of 3. The quiz question, blank is abnormal breathing pattern from the brain stem of irregular gasping breaths with vocalizations. So abnormal breathing from the brain stem. What is that called? And it is called agonal respirations. That's what happens just before someone is going to be in need of CPR. So if we hear those irregular gasping breaths with little vocalizations, better get ready for CPR because they're going to need it. We've got some movement again. Kiefer, great work, moving up. Off we go. Quiz question. Multi-select. An AED recognizes what 2 shockable rhythms? I already mentioned this. So what are they? The AED recognizes 2 shockable rhythms. What are they? You can pick more than one because that's the right answer. ventricular fibrillation and ventricular tachycardia. So those are the two rhythms an AED can shock. Up we go again. We've got some movement. Jamie, you've got 3 in a row again. Great work. 6-9 still in the lead. Can you beat them? True and false. Arterial bleeding is bright red and spurts with each heartbeat. Arterial bleeding is bright red and spurts with each heartbeat. And the answer is true. It's really hard to control because of it. Off we go again with a puzzle. Put them in order. The acronym for signs and symptoms are swollen. So acronym for signs and symptoms of an infection are swollen. What was that acronym we saw in the book? The acronym for an infection is swollen, swollen, blank, blank, blank. What is the acronym for infection? Swollen. Here we go. Swollen, heat, aches, red, and pus. So it spells the word sharp. Next one. Here we go. A quiz question. Compartment syndrome may occur related to what? Where does compartment syndrome happen from? Compartment syndrome may occur because of a crush injury. Great work. We've got some movement again. Sarah, you're in the top 5. Type in the answer. How many minutes do you flush a chemical burn for? Right from your textbook. How long do you flush a chemical burn for? And we flush it for 15 to 20 minutes. 15 to 20 minutes. Great job, everybody. Audrey, you're on fire. You've got a streak of 9. Let's keep it going. We've got 5 left. When the bones of a joint are no longer in proper contact, it is called what? The bones of a joint are no longer in proper contact. It's called a dislocation. No change to our top 10 or our top 5 list, but we're going to keep it going. True or false? The hypoglycemic patient needs sugar. The hypoglycemic patient needs sugar, and the answer is true, of course. Look at the points climbing, the top with 33,000. True or false? In a tonic phase, convulsions occur, breathing is noisy, frothy saliva appears, and the teeth grind. During the tonic phase of a convulsion, all of these things happen. Breathing is noisy, frothy saliva appears, and the teeth grind. In the tonic phase. And the answer is false. That is in the clonic phase. Do we have some movement? Oh, we don't have too much movement, but Jamie Kovac, 3 in a row, great job. Type the answer. Which type of deep frostbite presents with white, waxy, grayish skin and cold to the touch? What does that frostbite look like on that picture? What type of frostbite is on that picture? White waxy skin to grayish blue, black, cold with no feeling and frozen. And the answer is simply deep. It was right in the question. Do we have some movement? Leonie, great job, 9 in a row. Second last question, medical care is given by or under the supervision of a medical doctor. The answer is true. That's what medical care is. Megan, welcome back to the top 5. And our last question, here it is. The normal breathing range for a child is what? The normal breathing range for a child is 20 to 30 a minute as per your textbook. Let's see how everyone did. Third place, Audrey, great job, 35 questions right. Johanna, woo! And first place is 6-9. We're gonna figure out who you are so we can announce it on the Facebook and the website. Without your proper name, it's not gonna get put up. So make sure you put in the chat who you are. So I want to thank, you can see back into the Zoom here. Great job, everybody. I want to thank Marcia and Don for putting it together. Don's got a couple more things to add, so I'm going to turn it over to him.
I hope you've enjoyed the 2021 virtual OMFRC. Thank you and congratulations to all of the competitors, and thank you to Paul and his team, the competition committee, for putting this day together. This past year has been one of many challenges and some innovative changes for the organization. Early in the pandemic, we struck the Public Health Advisory Task Force, which has been guiding us since the beginning. Our therapy dog program adapted to window and then virtual visits. Our MFR volunteers have been participating at COVID assessment centers, shelters, and other community operations across the province. Most of our other programs have adapted to some form of virtual engagement. We successfully hosted our first virtual conference in AGM, and our next conference is coming up soon in April. We also know that this pandemic has posed some challenges, and I'm pleased to say that we've updated and reintroduced our critical incident stress awareness program, and we have some other member wellness initiatives underway. Like most of you, I really look forward to the day that we're able to come together for events like this, our AGM and investiture, our conference, and even our regular meeting nights and training. In the meantime, stay safe, wash your hands, wear a mask, and keep looking out for each other. We'll get through this soon. Finally, once again, on behalf of the Standards Committee, I'd like to congratulate all the participants and thank Paul and his team for putting this day together.
My name is Paul Sims. I'm the chair of the competition committee for Ontario. I am so pleased with the number of participants this year in this zone. The entire competition committee hopes you enjoyed the format, and I would like to thank each and every one of them. Don Smith, Sandra Ladd, Robin Innes, Anthony Chu, Lynn Tejo, Marcia Sens, Russell Walters, Nancy Hutchinson, Harvey Fields, and of course our admin staff, Claire Akinoid and Chris Schmidt. The Ontario Medical First Responders Competition, which is scheduled for this May 2021, is going to be virtual again as well, thanks to COVID. We are hoping for a better situation in 2022. Keep logged on to omfrc.ca for further details. Thanking you once again for participating in our very first virtual competition. Remember to be safe, wear a mask, maintain social distancing, and of course, wash your hands. Thank you.
So thank you everybody for attending. This is the end of the adult SFA competition. So what I would need you to know is that we're going to be sending out an email in the next day or so asking you what you thought of the competition, how the event went for you, and what we can do to improve it. So as you know, in May is going to be our virtual event again. So we need to know what you like and didn't like. So thank you again. Thank you everybody for attending, and we'll see you in May.
Thank you, everyone.